Hello everyone, welcome to my channel Physiotherapy. So our next topic is types of electrode placement and techniques in TENS. So what was the types? So there are 4 types and there is 5 techniques. So we can apply the pads over the nerve root dermatomal region during the pain of particular patient of different condition. So the first type is carbon rubber electrode plates. So you can saw the diagram on the screen. So why it is important? So the carbon rubber electrode plates is not much more provide a burn over the skin, and so the hypersensitivity over the skin area. So it is used and it is reusable and flexible. So most of the hospitals and clinics preferable carbon rubber electrodes. Second one is self-adhesive disposable electrodes. So it is very not much more cost. It is usable a single times on a single patient, or convenient for a particular patient which is a high luxurious, or like a patient who pay a much more amount for their treatment. So self-adhesive, it is like without any gel, they can place over the dermatomal and neural region, so they can send the signal of the pain and relief over there. Next one is a metal plate electrodes, very less used into the clinic and hospitals, and it is less common. On in over the sponge cover sheet apply over the metal plate electrodes. After that, it will be send the electrical stimulation over the skin, but it will be more chance to prone to cause the burn over the skin area. So it is less used into the clinics. Next one is silicone electrodes. So silicone electrodes is a pad electrodes where we can use into the after wet into the water, and after that we can use. So it is a durable and comfortable of the patient condition, but after some time it will be not much more usable in clinics and hospitals. Next is placement of the electrode into the TENS. So first is dermatomal placement. So dermatomal placement is placed over the nerve root and the nerve segments. Like a patient have to been suffering from sciatica pain, so we can use the dermatomal region of the nerve root over the pads. So it will be easily reach out to the across the nerve root, and it will be stop the signals of the pain of that A delta and C fiber into the dermatomal region. Next one is direct placement. If patient have pain as localized and generalized area, so we can place over the any kind of 4 electrodes pad over the area. So it is over the painful side we can place over there. Next one is nerve trunk placement. So there is a root where the nerve is originate, like L4, L5 region. So we can directly place over there. So it will be stimulate the trunk to reduce the pain into the primary or secondary nerve root fibers. So it is a peripheral nerve supplying we can apply over there. Fourth one is contralateral placement. A patient have hypersensitivity and painful wound, and it is like a chronic, and it is like a recovery phase. So where we can apply the opposite region to relieve the contralateral side for relieve the pain. So that is a contralateral placement. Last one is the acupuncture trigger point placement. So it will be a patient have like a knot, muscle knot, or like trigger point over the dermatomal or any kind of region. So over the specific acupuncture point or acupoint, we can apply the any kind of 4 electrodes plates. So that will be easily reduce the pain into the trigger points. So that is the placement of the electrodes, and there is a types of electrode. You can write university examination for good marks, and for 2 to 3 marks. Thank you.